Okay, so it's a pleasure to meet you all. My name is Michela Tinelli. I'm a pharmacist, health and care economist as well. I'm based at the Care Policy Evaluation Centre. It's part of the London School of Economics and Political Science. I'm also an NIHR School for Social Care Research Leadership Fellow. And as part of my fellowship, really, I'm looking into data in social care, the importance of preference data and their use to support decision making in social care homelessness. Today, the presentation, I will talk to you about data again, but not just around preference data from user. We will look at a larger spectrum of information and data available to social care. We look at the data with a specific case study and service implementation for people experiencing homelessness. So I'm very happy to kind of have an interactive session. So we will stop, we will take questions here and there, but also feel free to stay connected with us even beyond the presentation. So I know that people are very busy, so we might need to drop at 11. But again, here's my email. You can contact me and we can have a dedicated chat here later on as well. Okay, so I must say I'm quite excited because for me it's a bit of an adventure and taking you through my journey into data in social care. So, okay, so here we start. So, as part of today, we will look early. We will have an early look, let's say, at the approach to gather data, analyze information, and present them to inform different things in terms of planning, in terms of commissioning, delivery, evaluation of effective and cost-effective services. So there is a lot. We will have a chance to discuss things together, how to shape future steps together for this approach. And I would very much welcome your involvement in this. So it's very much a test bed for me in homelessness to test the approach because of this high complexity of homelessness environment. The unmet needs require very much coordinated multidisciplinary approaches, a lot of players to support homeless services, and of course there's a high risk of harm and death within homelessness. So if we can succeed really in applying this data-driven approach within this context, I'm very sure that we can apply the same principles to other ecosystems. And this is very much the case. So we would like to kind of assure that transferability to other users, patients, client groups in social care and in health. So just to kind of talk you through the webinar today, so we will have a look at the background to the approach. We will look also at the use of the data to inform service implementations. And then we will look at also the next steps in terms of visualizations, or we say dashboards, and also questions, comments are very much welcome. So we will open the floor to the discussions. If we have time today, there is a colleague that is working with me, Alessi. She's ready to show you some dashboard live online, but no worries. I mean, this is something that we can do also later on, and we have a number of events scheduled for 2024 where we can show to people dashboards live and we can have dedicated discussions. So it's something that we can plan together for later. Okay, so this is the background. So we will look at understanding this sort of developing the data approach. It's a bit of a warning. So now we are looking at what is the evidence-based planning, commissioning, service delivery, and evaluation. So we need to prepare is a bit of a busy slide. It's quite of a complex ecosystem we are going to visualize now. So bear with me. I will talk you through. So there are different dots. I mean, different sets of people, players really, those who plans and commission care. You can see integrated care boards, local authorities, NHS trusts, and other locally that they play a crucial role, but also national central government departments and other like bodies like NHS England and more. So all of them are very much big players. We have who provides care, and again we have different groups in terms of drug and alcohol services, other social care, you see criminal justice, mental health, housing, in terms of statutory and voluntary sectors. So loads of them, even beyond healthcare, that is kind of usually visualized and the focus very much of the attention is on health, but you can see there's loads and loads of more players that play a crucial role. We have those that experience care, so we have the individuals, we have the families, the carers. There is more in terms of evaluation, so those like myself, the academics, that we act as external evaluators, and we play again a role in presenting analyses and visualizations and everything. And also those that plans and commission evaluations. And you can see all of us in a way connected here. We are all players. We all need to be, well, very much joined up. This is crucial to secure success. But there is more. How can you do this? There is a lot that we can say in terms of data. So data science, they play a big role, and these integrated platforms that can support better discussions and data. So you can see here at the center, at the core, I have the care quality evaluation in terms of electronic platforms at the core of everything that can help connecting all these dots within the ecosystems. So everything can function well, and is a kind of a supporting tool to operationalize, manage services through, you see, continuous data collection, analysis, reporting. There is a using integrated management dashboards. So, and you can see that by joining us together, all these dots, through the platform, the ecosystem can then drive to advancement in care. So we can see that we can finally move the needle. And this is very much a success in terms of efficiency, patient-centered focus in health and care delivery. So we can say ourselves like in a blockbuster movie. So a lot of actors, but everyone need to play and have a crucial role, and everyone needs to work together to have the ecosystem functioning well. So we can really have leading enhanced outcomes for individuals, but also society as a whole. And if we move now to this slide again, it's quite complex, but I can talk you through. Here I want to visualize to you the life cycle of health and care initiatives. They can be intervention services, care models. So all of them, they kind of involve different stages, and each of these kind of stages is very much crucial for the success and continuous improvement of this sort of initiatives. And you can see there are different stakeholders. They include the healthcare professionals, practitioners. We have the individual users, the carers, but also the commissioners, the policymakers, the analysts. All of them, they play a very much vital role throughout the process. And you can see the platform, the care quality evaluation. I place the focus on a specific element. So is this sort of platform is designed to be kind of a dynamic tool, a responsive system that support continuous data collection, monitoring, evaluations, and drive the production of these insights that can then provide recommendations to enhance more improvement in service delivery. So, and again, here we can finally see the needle moving. Okay, so in terms of background and the case study in homelessness, I wanted to give you here a bit of a history, really. So back in 2020, 2021, really, the Department of Health and Social Care, Ministry of Housing, the local government, Ministry of Justice as well, collectively, really, they allocated 16 million in funding to 17 different local authorities. So this sort of funding was designed for the establishment of a kind of a testing of models for out-of-hospital care. So they established the program, and this was tailored to individual experiencing homelessness. So the goal of the program really was to drop down the number of cases discharged into streets, drop the readmissions, drop unplanned hospital visits, and homelessness as a whole. So, and additionally, this aim to foster improvement for individual health and well-being, really. So, DHSC, they really conceived this program as something that then was very much kind of developed on the basis of previous research authored by CPEC, King's College, UCL, so all of us together as a partnership. And then again, in 2021, up to now, really, we just came to an end. We completed an evaluation that was co-led by Professor Corns, that I know she's connected from King's and Salford University. It was myself also, the two of us, we were leading this program. And very much this is the focus of the case study now. So today, we are not just discussing the results, but we are seeing what the evaluation team worked to. So to improve information available to policy makers, commissioners, and service leads. So there is a lot. So for the first time, really, we introduced standardizations in data collection over 50 metrics, and we mean the measures that are used to assess and track the evaluation of various aspects of performance, progress, and quality. And we kind of organized a little collections of data in kind of, you see, in kind of chapters. So each of these sections really, we have specific visualizations or dashboards. So you can see there's loads of them. Okay, so in terms of the aim of the program, really, we look to support all the test sites to develop their own dashboard of key indicators. So we meant visualization. So with my team, we created a number of these visualizations to help service providers make a strong case for future funding for local commissioners. So, but it's not just about securing funding, it's very much also to contribute to the kind of bigger picture of national decision making for health and well-being of the population. So you can see on the right different things happening in numbers. So it's quite small size. So no worries, I will share everything with you later, and we can even go into the details of things if you want. Okay, so I just wanted to flash just briefly some early impact. So we are very much pleased because there are links to our dashboard now accessible from the NHS England website, the frameworks on health inclusions and also intermediate care. They report our dashboard as operational and management tools for homelessness stakeholders. And again, there are a couple of links. You can navigate the pages and see. But here is a quote very much specifically on the dashboards. Okay, so we are moving towards the slide, and now we are approaching the use of the data to inform service implementation with application to homelessness. And with this slide, I wanted to present you the journey from the data collection, the processing LAC, and the production of the outputs. And there are loads of them, and I will talk you through them all. So in terms of data collection, we managed to access different set of information. So at patient level data, the individuals, we had collection number of questionnaires on person outcomes, experience of care, use of resources, their preferences. We had access to hospital statistics data via the local groups. They connected up with the NHS Trust. They shared information with us. Also, site level aggregate data on monitoring, on service delivery costs, very much important. So all of these data came to LSE, and in a way we built a big data sets in terms of huge spreadsheet in Excel, basically, with loads and loads of row, meaning patients, and for each of them are individuals, and for each of them we have different metrics and variables. All these data were then processed, and we produce a number of output of reporting. So we have different dashboard visualizations, and we name them as being static in a way when you are not so much interactive dashboard. So you cannot interact specifically with the visualization, but they are nice infographics, they are in PowerPoint, so there's a set of visualization there. And we created these specific sets, one per each of the individual sites connected. Those that share data with us, again, we produced a nice set of slides for them. But also we have one visualization static still for the whole national program. So you can see at glance everything in terms of the key metrics, key data across the program. On top of that, we have also more kind of exciting things in terms of interaction via the website. So you can navigate the website and you can see things happening. You can play with the data, you can filter visualizations, and according to what you select and do, you can have different infographics appearing in front of you, and you can download data and everything. So this is what we produce in terms of output, and I will describe to you in a minute, one by one, in examples. In terms of the aims and objective of the dashboard, really the focus of these integrated management dashboards are to serve as a management tool, I said before, for both different sets of stakeholders locally, but also at national level. And the primary objectives are different things. So we are looking into performance and monitoring, for example. We want to track and monitor the performance of out-of-hospital care provisions throughout the national program that we mentioned. In terms of quality assessment, again, we want to kind of evaluate the quality of care provided to the individuals. We want to assess the effectiveness and outcomes of care. It's very much crucial to ensure high quality healthcare delivery. We mentioned reallocatable resources. So again, we want to optimize the allocation of resources, including staff, other things to meet the needs of the individuals. We look into more kind of trend analysis in terms of budget utilizations, person outcomes, and other things to identify partners and make informed decisions about service improvement. But there is a lot to say in terms of risk identification, for example, identifying potential risks, challenges that are associated with the program, and I don't know, gaps in care delivery or delivery strategies that can be then placed to mitigate these risks. So all this information can also be provided by the dashboard. We provide benchmarking, so the dashboard can allow to compare things. So we can compare performance metrics against national targets and see where there are improvements in which areas. And of course, very much important to us is the kind of reporting, the transparency to provide clear and transparent overview of the programs nationally and also locality-wise as well. We have a continuous improvement to inform the collection and the analysis. So there is lots of things happening. In terms of how they work, we have visualization, I think I mentioned already. So we have interactive charts and graphs that can visualize things for you, and you can filter, customize things. And you can, for example, filter data according to specific time periods, financial years, or locations within London, outside London, and compare things. And also benchmarking. So we have a national average that can be compared. So you can compare against national average of different things and help organizations to understand better how measure according to national scale and identify areas where more is needed. So you can look at regional localities, both typology of service provisions, but also individuals, localities and sites can compare each other and learn from each other. Okay, so in terms of what the dashboard provide, we are very keen to provide actionable insights, not just to overwhelm people with loads and loads of data, but help them navigating through data and capture the key information that can be then used to inform service decisions. We want also to make sure that everything is there for them, user-friendly, so we flag positive outcomes. So where we emphasize positive trends in improvement in terms of increased access to peak care, improved outcomes, so we can flag where things are working well, but also if there is any challenges or any room for improvement and accessibility issues or other things. So again, this is also part of our reporting. And here we have some examples. So one by one, I wanted to give you an example of the key output. So for example, we provide individual case stories, and all of us, we know that big data are important, as well as the individual stories, the power of stories, and how much can be communicated looking at the pathway of the individuals, what happened to them here before they approach services, and then compare after. So we account for 1 year before moving into out-of-hospital care, and we account also for the year after moving out. And you can see different things happen to this individual in terms of contact with services, mental health, healthcare, social care, housing, criminal justice. So before going to service, the specific individual was in prison a lot of times, very much in and out of very temporary accommodations, very costly. You can see we looked at all these contact with services, and we account for the economic consequences. But then we looked at what happened to the same individual after when they left. So there is a dramatic drop in criminal justice offenses and everything, so nothing at all after. And you can see what happened in terms of housing support and service delivery that again we costed as part of the exercise. So we can offer breakdown before and after, and see how we can play shift in budgets across different options. But again, we can do more in terms of quarter data for individual localities. So here again, we have one of our localities. So we produce a static dashboard again, a set of PowerPoints. We have 13 slides. One by one, we have first one providing a glance, the key metrics. You see improvement, budget release, but we have key outcomes. And I will share with you, so there is no need now to go into the details, but one by one, then the slide that can offer more in terms of service flow, in terms of health outcomes, experiences, and everything. So one by one, we take care of all the metrics and we provide details. At the end, you have a summary with what was good, what if there was any challenge, any opportunity for improvement. Again, we flag everything. And also we offer more details in terms of what we did, the methodology, and it's all part of the slide deck. So you can have all this information at once. I mentioned you also the static dashboard for the national view, for the national stakeholders. So there was a lot of learning from what back in 2018 really NHS benchmarking network did for the intermediate care and the audit back then. So they run a national audit and they produce these nice infographics presenting different typology of service and then different metrics for them. Workforce, you can see referrals, waiting times, also cost, repair service, user accepted. So all these things were already produced back then. So what we said, okay, so let's try to reproduce the same. And this is what we did. So in our way, we updated the similar framework using our data. And you can see now as a static view, we compare different metrics. You can flag different things happening in terms of staff members offering the auto hospital care program, number of people accepted, and we flag different models in terms of pathway 1 and pathway 2 across these different outcomes. But again, there is more that we could offer now in 2023. So we looked into interactive views of showing data, a more advanced way of playing with data and be more interesting and appealing. And here we have a website that we created using the LSC infrastructure. So you can access navigating this page or contacting the team. We can send everything to you. So basically, there is this web page. It's very much interactive. And we are quite pleased that now today we can launch finally our beta version. Basically is not finalized yet everything, but we want to share live something with you. So you're very welcome to navigate the pages, play with data yourselves, and give us feedback after. It's quite a process. So what happens really? You go to on the website, you can click on accessing the dashboard, and what we can do, if you complete a little form, it takes just 1 minute, so you can say who you are, where you work, and etc. And we know more about you, then we can send you back tailored information. So if you are involved in the out-of-hospital care model, and if you are local commissioners, again, we can share the dedicated set of information. If you are a national commissioner, other things can be sent back to you. But also, and I know that a lot of the people connected today, they are not very much part of the out-of-hospital care program. Still, there is a lot that we can discuss with you all, visualization that can be relevant to you, and we will share, and this will allow hopefully some learning, not just around out-of-hospital care model, but around the framework, the evaluations, and opportunity together to consider the transferability of what we did here to other services, populations, and environment. So all of you, please keep contacting us. I'm very happy to send you materials and have dedicated discussions as well. So if you are national users, part of the out-of-hospital care model, you will receive different things. So, and prepare is quite a busy slide coming, but I want to kind of impress you with the flow of all the data coming out of the dashboard. There's loads and loads and loads of information, so you will have the opportunity to click on things and access one by one all these visualizations and understand data with us. So there are kind of collections, and one by one, different button will show you different things. So if we go back now to what I showed you at the beginning, the circle of the health and care initiatives, you can see here where the care quality evaluation, the platform is located in terms of focus. What does this whole approach mean for you now? So there is loads of things that I showed you. I'm happy to stop if you want, and we can breathe together, but the idea is really is that if you commit really to provide data, so we cannot do anything if we don't have data. So first of all, LSE needs to access data. But then if you commit to use the dashboard, so what we do for you, and there is of course some little payment to be done to maintain the dashboard live, then there's loads and loads that can be done. So you can see what you can access, continuous data collection, analysis, and reporting. So not just one-off, but continuously. A number of case stories can be visualized. So we are not looking into big data and core data, but just also case story analysis and the power of the individual stories. We have metrics and a standardized and consistent approach that allow collection across different localities and hopefully comparability, because if everybody use the same platform, the same metrics, then there is opportunity to compare data, look at benchmarking against national trends and analysis. And of course, being an external evaluator, we can offer all for you without, the biases of being one of the providers. And there's loads of opportunity to transferability of the approach to other settings and other populations. Okay, here we are, moving slowly to other things. So the next step that we have, so we are not stopping here. So we did a lot already. It took us a couple of years really to come where we are. Sorry, can you hear me now? I don't know why it stopped, but I was just mentioning that here there are more things exciting that can be planned. Next step, so a lot happened already in the last couple of years, thanks to the hospital care model program, but there is more and more that can be done, and we are already planning a lot of exciting things ahead. Well, so looking into what this approach mean for you. So in the previous slide, I meant to say, so by you, I meant to say service managers, I meant to say service planning and commissioning. So for people more local area, but also at national levels that are very much dedicated to the planning and commissioning of services. Policy makings, both locally and nationally. But I was wondering whether you feel there might be someone missing out, and I don't want to miss out anybody. So let us think together for, let's say, a couple of minutes. Is it okay, Jess? I think that we have more slide ahead, but if we can just breathe a little, and if you have any suggestion in a way. So we have been looking into an approach, a process, a lot of players, and there was a big busy slide at the beginning showing us all. And so far we produced number of visualization dashboard pages for dedicated stakeholders. I was wondering whether you feel there is anyone that we missed out and should be there.
Michela's inviting anybody to just throw their ideas in the chat if you think there are some glaring gaps.
And just, sorry, help me out in looking at the chat, because
yeah, we've already got some good points here. Voluntary sector, and patients and clients.
Yeah.
Michela, you carry on and I'll let you know if anything else pops up.
Exactly. So this is the opportunity here to involve us all, and for everybody really to have dedicated pages, interactive dashboard and data. I was wondering whether we would need to have more dashboard for frontline practitioner, for example, and if this is the case, how this might look like. So in this case, we would have individual client at the center. We would have opportunity to real-time data monitoring collection as we did before, but looking at individual client journey, so we can track the journey together. We can make sure that there is a contact within services, and all of them can be connected in looking into the story and feeding information to share with everybody. And of course, from the information, the data shared, an opportunity of collecting data again from the individual. We can then track down metrics, outcomes, and look more and more into resource allocation as well, because if we consider, as I mentioned before, the individual story analysis will be quite similar. So you can see number of account, the contact with different typology of services. You can then look at resources and what it means in economic terms to follow up and meet the needs of the individuals. And of course, the more you track them in terms of data and the longitudinality of the data, if you stay connected for a long time, and then you can long-term data collection as well, you can see trends and opportunity to fully explore the benefit of services on these individuals. So this is just an idea, but more, of course, can happen, and this won't stop us in progressing what we did so far for the other dashboards. Everything will be there in the development alongside the current work. Okay, so here just to mention connecting dot, everybody needs to be connected, fully function. Again, next steps in terms of the roadmap to building the platforms. We are at the beginning. You can see what you can do with data. So the more data you have, the complexity can be there, but you can learn more and more, not just describing information, but understanding the why things are happening, and then what is likely to happen if you can predict on the basis of information, historical information collected. You can predict next stage is what might happen in the future, and also define future action and insights. So this is something that we already started, of course, on a small scale within the out-of-hospital care program. We already started collecting data, and there is more of a manual process so far for us. But we are keen to move to the next step. So accessing more and more data that can allow these things to happen. I have an automated process in place, not just a manual one, and also allow for more training initiatives, workshops, and other things happening. And I thought even the discussion today would be quite useful to have recorded so more people can access and learn more about the platform. And then opportunity again to apply to other services, population and environment. So we are in discussion with other colleagues, even beyond homelessness, to see whether the platform can work for them, and so what we can do together. So there's plenty of potential locally, nationally, and even beyond. And here we are. So in terms of the future in 2024, more things will happen in development, and workshops will be there to discuss with national users, local users, other people. Everybody is very welcome to contact us. And if you want to be part of this discussion, please let me know, and I will make sure that you are there and we have our chat. And we can have it even one-to-one if you want to do. To discuss things with us. But really, the key is that LSE is ready to support now the development of this automated version that I mentioned. So, but there is a but. This is very much contingent to know whether you all are committed to providing the data. As I said, without data, there is very little that we can do. Also using the dashboard and also in a way covering some little cost that might be associated to the running of the dashboard for the future, this automated version. Okay, so here we are at the end of the presentation. Hopefully we have our 45 minutes or so done, and 15 left for discussions. A question for you really. So I've got three cases. Case number A, so we have a current system snapshot where looking back to the busy slide, the stakeholders operate in isolated silos, they are not connected, and there is very much an emphasis to what happened in the past and not what is currently happening. So we are kind of losing the continuity of the data and the opportunity to do more. There is another option B where we don't do anything at all, so no evaluation at all. So in A, there can be sporadic evaluation, piloting, we stop and we re-engage, and maybe something can happen, but there is some buts. And in the do nothing approach, nothing happen at all, so there is no system improvement. In C, we develop a system together and we promote change together. So we foster collaboration among us all, and there's a shift to real-time assessment and intervention and continuity to secure better outcomes for the individuals and for society overall, really. So which one would you prefer? And let's discuss together, really.
Well, I challenge anyone to say do nothing at this point. Michela, do you want to finish off your slides and then we'll close it down, and then it's easier for people to see each other?
Exactly. So everybody really needs to play their part, really. This is just a call for everybody. We are all adult in this on the screen, really. Each of us can recognize themselves as adult, and we all need to be connected to each other. And the reason that we are all here today, I think, is very positive in a way. We are connecting and we are sharing, we are discussing. So I'm very keen to have the opportunity to discuss with you all and take any questions or comments. But yeah, big thank you also to all the people that have been working with me so far. It's a long list, even beyond the people named here for this case study homelessness team, and I see a lot of faces I can recognize on the screen. It's very good to see them all connected today. It's a pleasure, and I'm happy to discuss with you all.
Thank you so much, Michela. Should we stop recording now, and we'll open it up for questions.